Hello, everyone, and welcome to the 4th Annual VHA Innovation Experience. On behalf of the Veterans Health Administration Innovation Ecosystem, I would like to thank you for choosing to be a part of this exciting event. My name is Eric Bruns, and I will be your host over the next 2 days. I am the Executive Director of the Simulation Learning, Evaluation, Assessment, and Research Network, or SimLearn, and we work hand in hand with the innovation ecosystem to ensure veterans receive the latest technologies and processes in the healthcare industry. This event brings back everything attendees have come to expect and love: iEX talks, demos, engaging presenters, and a revamped Shark Tank competition, as well as a few surprises. Let's face it, iEX is a fantastic event. It brings people together from different parts of the country and different walks of life to share experiences and gain perspective from their vantage point. This year's theme is Breaking Boundaries, an opportunity to showcase and celebrate how VHA innovation, collaboration, and technology are breaking boundaries, forging the future of veteran healthcare, and most importantly, changing and saving veteran lives. For me, breaking boundaries means breaking through the accepted processes and the expected methods to turn the improbable into the possible. I participated in iEX for several years now, and the thing that always strikes me during this event is how colleagues throughout VA are constantly seeking ways to improve the veteran experience. Many assume that the government, and therefore VA, is stagnant, not creative, and that just isn't the case. VA is an extremely exciting and innovative healthcare system which promotes an innovative culture derived from the shared mission of improving the veteran experience. Our lineup over the next 2 days demonstrates just that. Before we dive into that lineup, I want to go over some technical aspects of this virtual event. You are watching me and this year's innovation experience on an interactive social platform called Socio. Here are some tips for navigating the platform. First, how to find the agenda. On the left side of your screen, you should see a navigation bar with multiple tabs, including the agendas for day 1 and day 2. When you select the day 1 agenda, you will see the full list of events for the day with descriptions and images. You can select any of those events on the agenda and find out the information for that session. You can also create an agenda for yourself, found under the My Agenda tab on the navigation bar. You can scroll through and add the events you'd like to see, and then the event will be saved on your personal calendar. You'll also receive notifications for the events. Finally, if you have any issues navigating Socio during the event, please select the FAQs tab on the navigation bar. Here you will be able to click a Zoom link to chat live with some of our support team. Now, I have the distinct pleasure of introducing the 11th Secretary of Veterans Affairs, the Honorable Dennis McDonough, who will be kicking off our innovation experience. President Biden nominated Mr. McDonough to lead VA, and he was confirmed by the United States Senate on February 8, 2021. Before coming to VA, Secretary McDonough served as the 26th White House Chief of Staff, working across the cabinet to develop and execute critical U.S. priorities in national security and domestic policy. Before his tenure as Chief of Staff, he served as Principal Deputy Security Advisor, Chief of Staff for the National Security Staff, Deputy National Security Advisor for Strategic Communications, and Chair of the National Security Council's Deputies Committee, answering complex challenges of crisis management and national security policymaking. And in all those roles, he helped lead the administration's work on behalf of veterans and military families. He believes deeply, as he testified to Congress, that there is no more sacred obligation nor noble undertaking than to uphold our promises to our veterans, whether they came home decades ago or days ago. Please join me in welcoming the Secretary of Veterans Affairs, the Honorable Dennis McDonough.
Wow, thank you so much, Eric, for that. Thank you so much, Eric, for that very generous and kind introduction, but more importantly, thank you for your uh, years of service, your decades of service in uniform, and your continued service to the country here and to your fellow veterans here at VA. Um, Good morning, hello to everybody, and welcome to the 4th annual VHA Innovation Experience. Dr. Clancy, Dr. Vega, and everyone on the VHA Innovation Ecosystem team, thank you for working so hard to bring us together to showcase our VA employees' remarkable innovations and best practices, all of which underscore Eric's point, which is too often the country thinks that VA is not a place of innovation. In fact, I think, as I'll argue for the next couple of minutes, and as you show every day and our employees show every day, it's a place of great innovation. And of that, I'm deeply proud. Let me especially acknowledge, therefore, all of our great VA employees, those participating in the conference and those busy with other duties. You're the ones saving veterans' lives. You're the ones changing veterans' lives. You're the ones shaping veterans' healthcare for the future. And you're doing it over the course of the last now almost 20 months in a context that has been enormously challenging. Without missing a beat, you've been helping fight this pandemic. You've shown incredible courage and demonstrated an unwavering commitment to veterans and their families, often putting yourselves and your own families at risk while you do so. So I thank you from the bottom of my heart for what you do for veterans every single day. Let me also welcome the many partners who are joining us. Your support of VA's mission makes so much of this possible. And your record participation in this year's conference is testament to an important fact. That fact is that caring for veterans is a shared duty. The president often says that our nation's most sacred obligation is to prepare and equip troops we send into harm's way and to care for them and their families when they return home. It's a promise that we as a nation make to anyone signing up for military service. You take care of us, we'll take care of you. You fight for us, we'll fight for you. In fact, when he nominated me to lead VA, President Biden told me, you better fight like hell for our vets. And I'll tell you what, since this pandemic began, that's exactly what our VA people and so many of our partners have been doing. When it wasn't safe for vets to come to the hospital, they cared for, or to our clinics, they cared for our vets online. Ramped up telehealth appointments from 2,500 appointments a day last March to 45, that is to say March 2020, to 45,000 telehealth appointments a day a year later. When vaccines came on the scene, they sprang into action, got shots in the arms of millions of people, veterans, family members, deported veterans, and each other. And when VA or the broader healthcare system needed people, over 5,000 VA staff left their homes, left their families to help, deploying across 47 states, 5 US territories, supporting both the fight against COVID and natural disaster responses, all in the middle of the pandemic. In short, since the beginning of the pandemic, they've been fighting to marshal every resource available for veterans, from material resources to the most valuable resource, the human resource, themselves, yourselves. All the ingenuity you can muster, driven by admirable, powerful, unmistakable compassion for veterans. That's people like you, VA engineers, VA researchers, VA clinicians, VA inventors. And I want to take this moment to talk about actually to brag about, the people behind 13 of the many great innovations that came out of the pandemic. People with innovations that saved the lives of veterans, their families, caregivers, survivors, and civilians alike. And in the process, made sure that VA once again served its role as the backbone of the American healthcare system. There are people like Dr. Steve Braverman, director of the Greater Los Angeles Healthcare System, whom I met a few weeks ago. Very early in the pandemic, when 2 nursing home residents tested positive for COVID, Steve and his team jumped on it. He mandated testing for all residents and staff, the very first example of widespread asymptomatic testing and segregation of nursing home residents in the VA system. Well, they found 14 asymptomatic COVID residents and 8 infected staff. So they immediately established their CRU, their COVID recovery unit, to sequester the infected who didn't have to be admitted. Their quick action headed off a more severe outbreak that would have otherwise gone undetected. 1 resident died from COVID. It could have been far, far worse. Steve's practice at the time in innovation became VA policy. You may have read about it in the Journal of the American Geriatric Society. It's been shared across the medical community. There are people like Dr. Kenneth Goldberg down at the Durham VAMC. Ken and his team partnered with Patrick Bateman and Martha Wilkes in OINT and took their web-based COVID-19 screening app nationwide. It's screened more than 17 million veterans and visitors coming into VA medical centers, helping keep the veterans we serve, our employees, all of us, safer. There are people like the members of the Innovation Ecosystem's Agile Design and Production Transformation Team, or, fittingly, the ADAPT Initiative, that was called together specifically to support frontline workers in the COVID fight. It was ADAPT teams from Puget Sound, Charleston, and Richmond VAMCs who collaborated with the FDA, the NIH, and America Makes. They designed, tested, and fabricated PPE and millions of critical medical devices like diagnostic COVID nasal swabs, face masks, ventilator parts, and more in just 5 months. Dr. Joseph Ion Quinto and his team at the VA Puget Sound Healthcare System were supported by the VA Innovation Ecosystem in developing a reuse-capable powered air purifying respirator. They collaborated with Dr. Jennifer Delaney and Washington University in St. Louis to produce a full respiratory system that's approved for the public health emergency. This device protects clinicians and eased pressure on the national supply chain that was in crisis. The first 100 hoods were delivered locally to VA Puget Sound. Hundreds of the respirator systems are now being delivered around the world to India, Africa, South America. VA occupational therapists, Melissa Oliver, and rehab engineers John Miller, Brian Burkhart, and Seth Hills with Richmond VA's assistive technology team invented the Clear Talker mask. The Clear Talker mask. The Clear Talker mask meant hard of hearing and deaf clinicians and veterans could read lips, improve communications, that human connection vital to effective healthcare, vital to speech therapy, vital to mental health encounters, where facial and where facial expressions are central to trust and are central to the human connection. And there are people like Caitlin Rollins at Western North Carolina VA's healthcare system, and I must say, beautiful Asheville, who introduced virtual reality technology to community living centers and employee wellness rooms. Thanks to Caitlin, veteran residents confined inside because of COVID, inside that beautiful, in that beautiful area, can now interact virtually with the outside world. They can engage in immersive experiences of relaxation and meditation, walk through virtual woods, sit by a fire, rest on the beach. That's so important to their well-being. Minimizing loneliness, boredom, isolation, the hallmarks of this pandemic. The same technology in break rooms is helping employees fight COVID burnout during their breaks. And just last week, the VA in Asheville started using virtual reality with COVID inpatients. Ann Bailey will tell you about that a little later. There are people like Kyle Robinson, a registered nurse up at the St. Louis VAMC who partnered with Uniper Technologies to bring VA to veterans' homes. Thanks to Kyle's work, older veterans with mobility issues and technology challenges can now use their televisions to connect to whole health resources like Tai Chi, yoga, mindfulness, meditation, nutrition classes, and more. His setup includes telehealth so veterans can easily have a virtual face-to-face encounter with their provider. Or VA providers can drop in for a quick follow-up just to make sure the veteran's doing well. Kyle's system keeps veterans with mobility issues safely connected to their VA, whether that's because of COVID limitations, aging, or injury. It's still early, but veterans in the pilot report that they're exercising more and as a result, feeling more connected to the outside world. There are people like Bryn Cole, Director of Design for the Innovation Ecosystem you'll hear from tomorrow. Right now, Bryn and her team are reimagining veteran healthcare. They're going to help VA lead the nation in defining a post-pandemic transformative new normal for the healthcare industry. A little known secret is we've been doing that for generations. Bryn's not just studying what's changed. She's imagining what might change, what we can change to shape breakthrough delivery models that meet veterans' needs today and tomorrow. You'll hear from Bryn tomorrow. And Allison Gustafson, whom I'm particularly proud of, because of course, with a name like that, she's from Minneapolis, is working with Amanda Purnell and Marion Adley to lead VHA's long COVID community of practice. They're working across 16 med centers, and they'll be adding 26 more soon, so we can all better understand long COVID and how it's affecting veterans so they can help VA better care for them as they fight this illness. Not only help VA, but ultimately the whole American healthcare system. And in addition to the innovations born of the pandemic, like the 8 I just mentioned, there are many examples of important pre-COVID innovations that have helped veterans stay connected to care since the pandemic hit. Back in 2017, for example, Shane Elliott and Deanna Callahan at the VA Loma Linda partnered with Robert Durkin in our Office of Information Technology, our OINT, to design VetText, a popular VA healthcare appointment app. When the pandemic hit, Team VetText adapted the app to streamline over 17 million COVID-19 screenings and schedule nearly 250,000 vaccination appointments. And Charles Franklin across the country at the New England Center for Innovation Excellence partnered with VetText so vets can use the homeless rideshare program he designed to get transportation to vaccination sites. And because Eli Kaufman and Danny Abramson out in Seattle started bringing VA orthotics and prosthetics teams to veterans who couldn't easily get to the VA, they were perfectly situated to seamlessly provide prosthetics care to veterans when COVID hit. Now, I know these guys are in the crowd. They're unbelievable. Their mobile prosthetic and orthotic care is invaluable to many nursing home veterans during the pandemic. Thanks to Danny and Eli, those vets don't have to choose between maybe losing their beds, being quarantined for a couple of weeks, or getting no prosthetic care at all. So what do vets tell them? This is an absolute godsend. This is absolutely amazing. It's changing my life, what you guys are doing. Danny will tell you more about that later. And think about how critical the remote temperature monitoring is for preventing diabetic foot ulcers is during the pandemic. Tomorrow, Kyle Nordrum will put that into perspective. So there you are. People behind 13 innovations and adaptations that save lives and improve outcomes for veterans and civilians alike during this pandemic. Here's the point. The innovation experience is the VA experience. It's what you are all about. It's what the country and veterans need from us. It's happening all the time at VA and at VAMCs across the country. And it's breaking boundaries, changing lives, and saving lives. So while we want our lives to return to normal after the pandemic, let's admit that some things shouldn't go back to the way they were. We at VA, for example, shouldn't go back to an old way of doing things. As we look to the future together, as you do that today and tomorrow, as we do it together every day, we shouldn't try to build a VA that goes back to some old norm. We should, in fact, must continue to do better for vets. We must continue to be better for vets. And that's what VA's innovation ecosystem and this conference is all about. As you know, VA has a long history of innovations, from the cardiac pacemaker to the liver transplant to the nicotine patch. But what I need from you, what veterans need from you, and what the ethos of this ecosystem demands of you isn't ever the last innovation. It's always the next innovation. The next innovation. It's a future of how we provide unparalleled access and outcomes to vets and drive the entire US healthcare system forward in the process. Because VA is going to continue to deliver more care, more benefits, and more services to more veterans than ever before, with advocacy, access, outcomes, and excellence as our guiding principles. But make no mistake, we can't do it with all of you, without all of you, without each and every one of you, and the innovations you create, and the compassion and the passion for each and every individual vet that you bring to the fight. So I thank you. God bless you all and the work you're doing. God bless our nation's troops, our veterans, their families, caregivers, and survivors. And may we always do as you do every day and give them our very best. I thank you all very much. Eric, back to you. Have a great conference, everybody.
Thank you, Secretary McDonough. It's an absolute honor for you to be with us today. And I think your powerful remarks are a testament to our leadership's commitment to VA staff and our mission of serving the nation's veterans through innovation. Now, I have joined me the Executive Director of the VHA Innovation Ecosystem, Kit Teague.
Thanks, Eric. I'd also like to echo Eric's sentiments. I really appreciate that Secretary McDonough was able to join us and talk about all the great innovations that we're doing at VA and thank him for supporting innovation. I'd also like to thank the innovators that he mentioned, as well as the innovators that he didn't mention that are doing innovation behind the scenes to make those innovations possible. Without them and their push to break boundaries, none of this would be possible.
Thank you, Kit. As the Executive Director of the VHA IE, that's a great observation. And we're going to see some of that innovation next in the iEX talks. But first, I understand you have some type of announcement for us.
I do. We've got a brand new logo for Innovation Ecosystem. Can you guys roll the clip?
So what's the deal with this, Kit?
It's pretty snazzy, right?
Yeah.
Yeah. So when Innovation Ecosystem was spun up about 4 years ago, we had the light bulb that you saw previously.
Okay.
And the light bulb kind of represented, a single idea of innovation. But over the years, as we've innovated, we've kind of learned that innovation is just not a single idea. It's something more than that. It's about employees, it's about veterans, it's about partners, all coming together to push forward and innovative ideas so they can take flight. And innovation is really a team sport, and that's what our new logo is all about.
All right, I get it. So the take flight, that was that airplane
That was a little
thing?
airplane circle thing.
There you go. Wow, that's really something. Thanks, Kit. Here's an overview of some of the great things the ecosystem is doing.